So let's now speak to Seth Panyako. He is the Secretary General of the Kenya Union of Nurses. He's joining us live by way of phone. Good afternoon, sir. Thank you for joining us. We've been speaking for a while, sir, and you've been complaining. But yesterday we did see the President direct the Ministry of Health to prepare that welfare package. First off, let's get your thoughts on that. Is it enough?
Yeah, we welcome the statement by the President and the directive of the Ministry of Health and that of Public Service to prepare a welfare package for frontline health workers. That one, as a union, we have welcomed it because it is something that we have been asking right from the day the first case was confirmed in Kenya.
But then, is it enough, sir?
We cannot say whether it's enough or not until we see the package that's going to be worked on by the two ministries. Our expectation is that the two ministries are going to involve the leaders of the health workers. We have already worked on our proposal to the two ministries, and the proposal from this union, I think, has already landed in the two ministries. We expect them to put into consideration our proposal in terms of the welfare package to cushion frontline health workers.
Okay, let's talk more on what needs to be done in terms of, the personal protective equipment, the PPEs, the number of workers. Talk to us about that.
We, first of all, want to acknowledge the efforts being made by the government in terms of approving the local production of personal protective equipment, as well as removing the bottleneck, so the bureaucracy with the cancer, which has been at war with the county government, thus allowing the county governments to procure the personal protective equipment directly from those companies producing them, as well as those which are being imported. We also, the only problem that we have with the personal protective equipment is that despite the fact that the government is putting in a lot of effort to ensure that we have enough, our members from the ground are very clear that the personal protective equipment have not reached them. Many nurses are saying that they are being given, for example, one mask to be reused, and some of them are saying those masks more than is allowed, and therefore we do not have enough personal protective equipment on the ground. Apart from those counties that have already reported these COVID-19 infections, the area of isolation has the masks N99 and N95 and surgical gloves. But the surgical masks and other protective gear, including the suits, including the caps, including the hoods where they are there and the campus. But what we are saying, they're not adequate. 85% of health workers in Kenya do not have personal protective equipment. And even before you talk of personal protective equipment, how will you be able to say you are supplying personal protective equipment to health workers who have not been paid salary for the month of March? As we are talking today, Homa Bay, workers are not working because they have not been paid for March. They have no money to pay fare. Their houses, some of them have been locked. They have no money to buy food. The same applies to Vihiga. Machakos here has not also paid salary. And I hear that in the North Rift, we have so many counties that have not paid salary. So basically, we must ensure that health workers are first comfortable with the current conditions which are there. Pay salary, pay federal deductions, and ensure that health workers are comfortable with what is there. If you cannot provide what is there, how will you be able to provide what is not there?
You're right, sir. Now, before I let you go, let's talk more on the welfare of healthcare workers in terms of transport from, where they're working, the hospitals, to their homes. I remember I was trying to look for the date of when Dr. Amoth said it. I couldn't find it, but I remember that has been said. Is that being done? Plus also that facility that was set up at the Kenyatta National Hospital for any healthcare worker who may test positive, that was confirmed by Dr. Kamuri, should be about 2 days ago. Talk to us more about that.
In terms of isolation of those health workers who test positive, we have no problem with that. Our problem has been quarantine, or rather having hostel facilities for frontline health workers who are directly involved in management of COVID-19 pandemic. Those workers who are in isolation and those who are at screening levels in the casualty department. That has not happened. And you see the case of Ngara, where a clinical officer came in touch with a patient and went home and infected his husband. So our view as nurses union was that like Kenyatta National Hospital has got enough facilities to actually provide hostel facilities for these frontline health workers, as well as the government can go ahead and even have agreement with the Silver Spring Hotel, which is close to Kenyatta National Hospital. I am happy that Kisumu County government has already worked on Crown Hotel, which is now going to be where the frontline health workers will be staying until we control the pandemic. I'm also aware that Mandera has also found a hotel where those frontline health workers charged with the responsibilities of managing these infected patients are going to stay, so that we allay the fear of infecting the members of the public when you use the public means, and also infecting your families. In the issue of provision of transport for Kenyatta National Hospital, I am aware that buses have been arranged that are supposed to be carrying health workers who are on front line. But the problem having in Kenyatta is that those health workers who are not on the front line, who are leaving work at 2:30, some of them at 4, they go and fill the buses. So that the frontline health workers, by the time they are leaving the places of work at 4:30, they find the buses have already gone and they are full and they have no means of transport. They have to find their way to town and go back to work. So those are the issues that we want the management of Kenyatta National Hospital to look into, to ensure that frontline health workers are not deprived the privilege to use those buses that have been provided by the management of Kenyatta to assist them. Otherwise, we laud the Kenyatta National Hospital management for the effort that is putting in place to ensure that health workers feel appreciated and protected.
Okay, lastly, sir, in under a minute, in your capacity as the SecGen KNUN, can we say so far so good in terms of taking care of our of the people who are on the front line, sir?
We would say that there is actually an intention to take care of the frontline health workers, but in terms of county government that have not paid salary, honestly, there can be so far so good. The so far so good that we have is actually at a national level. Intentions that have been taken by the national level, for example, of the president directing the two ministries, Minister of Public Service and Minister of Health, to prepare a welfare package for frontline health workers. That is a good intention, and we can say so far so good. But in terms of the ordinary problems of non-payment of salaries, remedy of statutory deductions, even Meru County government understand has not paid salary, we still have the same problem. I have a feeling that the president should look into this issue and declare an emergency in health sector so that it can set back health sector until the issue of this pandemic is handled.
Thank you, sir, as always, for joining us here on News Desk. That was Seth Panyako, the Secretary General, Kenya National Union of Nurses, of course, talking to us about that directive given by President Uhuru Kenyatta yesterday for the Ministry of Health to prepare a welfare package to cushion healthcare workers. Now, let's take a short break here on News Desk, but stay with us.